Welcome back and thank you for staying on All Angles. Now, sex workers and members of the LGBTQIA plus community continue to experience discrimination when seeking health services. That's according to a report by community monitoring organization Ritshidze. And for more on that report, we're joined by Ritshidze's researcher, James Oladipo. Thank you very much, James, for your time here on ENCA. Just firstly, you spoke to about 9,000 people within sex work and the LGBTQI plus community. What are they saying is their experience? Has anything changed? Has anything improved?
Thank you so much, Masako. So we spoke to over 9,000 key populations over 3 months and across 21 districts in the country, across 7 provinces. And just as in our last report, we are still hearing issues around discrimination, around refusal of service, around unfriendly attitude from facility staff, around lack of privacy, around lack of safety, and sometimes denial of services and being chased out of the health facilities, still having difficulties accessing key population-specific services like hormone therapy, like harm reduction services, like gender-based violence services for and STI treatment.
Now, there's something that you also found in terms of people actually being refused treatment at hospitals and clinics. Just elaborate this for us. Isn't this also illegal?
Yes, absolutely, and it's a breach on people's basic human rights. Our report shows that a significant proportion of key populations are being refused access into the facility. We have about like 19% of our respondents that are people that use drugs that have been refused access, 12% of sex workers, 5% of gay, bisexual, and other men who have sex with men, 9% of trans people that are being refused access for various reasons because they are part of the key population group that they are. We have incidences of people who use drugs that tell us they are being chased out of the facility because they are being accused of stealing from other patients, or they are being accused of not being their hygiene level is not up to standard. They are being sent to the back of the queue, and unfortunately, the majority of our respondents rely on public health facilities, aside from very few, which is about 12%, that do not access services anywhere because they are tired and they do not want to face those kind of discriminatory attitudes anymore. So they decide to just disengage from treatment entirely.
So for me, then, there's a lot of discrimination then taking place in our public health care, services for people who take drugs, sex workers, and people in the LGBTQI plus community. So has this made some of them? Did some of them tell you that this has made them decide not to even go seek assistance from healthcare workers anymore?
Absolutely. Unfriendly staff attitude was top on the list of reasons why those that do have stopped going to public health facilities as one of the reasons that they do not go. And another reason is lack of privacy, because people's HIV statuses are being disclosed in front of other healthcare users. People are being judged and victimized for being a sex worker or because they use drugs. And even those that use mobile clinics or drop-in centers, the poor staff attitude was one of the reasons why they choose to go to drop-in centers and not the public health facility. And unfortunately, there's not just enough drop-in centers for every key population to be able to go to access their health services. So a lot of them still rely on the public health facility, and some have just decided to say, I'd rather just disengage and stop treatment. And when I mean treatment, I mean like HIV treatment, I mean like TB treatment, I mean like HIV prevention services, like your accessing your condoms, your lube, and there are we are not even talking about all the services that are not generally available in the public health facilities.
So discrimination and just being judgmental, etc. Something else that you mentioned that's quite illegal is to actually discuss someone's health. There's supposed to be a doctor-patient confidentiality, even for the nurses who work at this clinic. So what's your solution then as Ritshidze? Have you, for instance, communicated with the government in terms of what the LGBTQI plus community and other members of the community are experiencing at our healthcare centres?
Absolutely. So one thing the model in which we use is that we just don't identify the problems. We would always present recommendations and solutions, which a lot of the solutions are generated from the community themselves, from this key population themselves. So amongst other recommendations, we are calling again for the National Department of Health and PEPFAR for at least 2 key population specialized clinics per district and this key population at a minimum, whereby key populations are able to go where they know they will access services without being discriminated, where it will be in a friendly and safe environment. Also for planned patient transport or resources, because there are a lot of key population that stay in rural area or in areas where they are not able to access these services and do not just have the resources to get to them. We have trans women that want to be on hormonal therapy, but this is only being provided in big cities like Johannesburg, in Cape Town, and they can't get there. So we are asking that the government also provide the patient transport or resources to be made available for transportation for them to be able to take up these services, because if there's no point if we provide the services and they can't get to it. So that is amongst the other things that we've asked for or that we've recommended. And also, I think another most important one is this continued sensitization of the healthcare workers, including the security guards, because after the clinical workers, the security guards came second on the list of people that the key populations feel are not always friendly and professional. So we've asked for continued training of the healthcare workers, including security guards and the security companies, to ensure that they treat the members of the key population very friendly and professional.
All right. Thank you very much for speaking to us, James Oladipo, who is from Ritshidze. Thank you very much.